Welcome back to the Now What podcast, a podcast focused on young adults, epilepsy, and the problems they face. I'm Karan.
And I'm Sophie, and we are advisors to the Cameron Boys Foundation. TCBF honors the legacy of our best friend Cameron by aiming to cure epilepsy through funding research, education, and awareness campaigns while still supporting causes that were important to Cameron.
And these conversations that we're having wouldn't be possible without our amazing sponsor, UCB. Each week, we're going to discuss an important topic related to epilepsy and young adults. And this week, we're covering the ketogenic diet and epilepsy.
Yeah, so with that being said, let's welcome our guests for the week. First up, we have Dr. Mackenzie Cervenka, a professor of neurology at Johns Hopkins School of Medicine. Dr. Cervenka is medical director of the Johns Hopkins Adult Epilepsy Monitoring Unit and developed the multidisciplinary Johns Hopkins Adult Epilepsy Diet Center in 2010. She and her colleagues have actually treated nearly 500 adults with epilepsy, glucose transporter type 1 deficiency syndrome, and refractory status epilepticus using the ketogenic therapies.
And we also have Mia Randall, who's a member of our Young Adult Community Advisory Board, lives with epilepsy, and has tried the keto diet.
Yeah, this was an exciting episode for us because it bridges a little bit of the gap between the medical questions and also Mia's personal experience with the ketogenic diet, which wasn't perfect. And I think getting to hear kind of a authentic point of view that's not always exactly what we want to hear brings a lot of value. So we are excited.
So first, I kind of want to start off by getting a clear definition of what keto is. I think being a young person, I just associate keto with losing weight. So Dr. Cervenka, what's the keto diet?
Well, thank you for this opportunity. I'm really excited to be here. The keto diet, actually, in our field, we talk about ketogenic diet therapies, and I'll kind of explain why that is. Actually, the ketogenic diet therapies for epilepsy have been around for more than 100 years. So you mentioned keto for weight loss. That sort of came about in around 2017. And that's when a lot of people first heard about keto. But if you look back in the literature and in libraries, it was a 1921 that keto was first introduced for the treatment of epilepsy. What that is really is any kind of diet where you are producing ketone bodies. Ketone bodies are the breakdown products of fat, so there are lots of different ways of doing that, which is why we use this term ketogenic diet therapies to describe any different type of way to go about creating, making ketone bodies and having that process take place. And so the classic ketogenic diet from back in 1921 was a diet where it was very specifically prescribed a ratio of fat to carbohydrates and protein in grams. And so patients actually had to weigh their foods on a gram scale. It's very labor intensive. And now we have other therapies that are similar to that, but that don't require that much close attention to exactly what you're eating. So that's why, again, we call them ketogenic diet therapies. And also just to emphasize, when you're thinking about epilepsy, you're thinking about a treatment. And so you want to be doing it with a doctor or another provider. You want to make sure you're doing it with a dietitian or a nutritionist because there are the risks of side effects, and you don't want to just stop it all of a sudden because you're not really treating it like a therapy.
That makes a lot of sense. Kind of jumping right off that, Mia, can you speak a little bit to your process as a patient of getting referred to trying the ketogenic diet and how you kind of found that in working with your neurologist?
Yeah, exactly. So I'm also very excited to be here and talk about my process because I feel like there weren't too many firsthand resources for me to look at. It was just a lot of data and information when I did my research on my own or talked to my neurologist. So I'm excited to put some out there. So for me, keto was medication has not really been working for me and for my epilepsy. I have refractory epilepsy, drug resistant. And so keto was a great path to try because it's low risk. We're not doing surgery. We're not putting in a VNS, any kind of implant. So it was a really great option to try. Really no harm in trying. And so we thought, great route. And it didn't work for me, which was unfortunate. I know it has worked for a lot of people. especially with people with my type of epilepsy, especially with people with drug-resistant epilepsy. So unfortunate for me, but I know it has worked for a lot of people. But I just kind of wanted to come in to also help people manage their expectations for the transition, because the transition from not doing the keto diet to doing the keto diet was quite difficult, especially on like your mental health and just that huge change in lifestyle. So that's kind of what I wanted to help people who are going to start their transition, just kind of help them with that.
Yeah, could you tell us what some of those challenges were? And like Dr. Cervenka, I'm curious if you've noticed some of those challenges in your patients and how you've navigated them through that.
Yeah, so I feel like when I started, so I did the ketogenic with the Rush Clinic in Chicago, and they were phenomenal. They were super, super helpful. The dietitians there, the neurologists there, they gave me tons of resources, tons of help. They were great. But I felt like from my neurologist and also people at the clinic, it was a lot of like positive reinforcement and very like, once you get into ketosis, you're going to start feeling great. Your brain fog will be lifted. You're going to feel better, and so on, which is true. Keto does, have a lot of great benefits, but through that transition period, my mental health was so affected because I didn't think about all these things and no one really brought these things to my attention. Like I had to go from, not really thinking about my meals. I'd be like, oh, if I want a sandwich for lunch, I'll just make a PBJ. Oh, if I'm feeling lazy in the morning, I'll just have some cereal. And then I had to go to very meticulously planning every single meal and cooking every single meal. And it was just so much energy going into all of it. And, and then I was hungry sometimes, or if people wanted to go out to eat and get pizza, I couldn't do that. Or, there's only a few things at every restaurant I could go have. Or if it was a birthday, I couldn't have cake and ice cream. So I had to learn to, make my own desserts or bring my own food places, or just learn that there would, I found ways that I could do these different things, but that initial like shock of like, okay, I'm isolated from everyone else now. I have to cook all my own meals. I have to bring my own food places. I can't eat whatever I want at restaurants anymore. That shock, that initial isolation and like, this is so much work more than I thought it was, is what like took that toll on me. But then once I learned how to deal with it, it was okay. And I found different tips and tricks, which I can share later on, like tips and tricks that really helped me. But I feel like people going into it can know that it's going to be a lot of work, it can help them get through that transition quicker, because it can really help them in the end and it can make them feel better. And if it had helped my seizures, it all would have been worth it in the end. I ultimately stopped because it didn't help my seizures, but if it did, like that trade-off would have been fine. It's just that transition period you just have to get through. And if you know what to expect and you can manage your expectations for that transition being a bit difficult, then you'll be fine.
Yeah, I think, thanks for sharing that. Dr. Cervenka, I feel like that kind of goes back to what you were saying a little bit about doing it with a clinic and feeling like you're at least supported in that sense. And a little bit, I think, what you're saying is this is all like, you can't just slack. And I would love to hear a little bit from you, Dr. Cervenka, about the adherence aspect and why is that important? And also just, what exactly does keto do for controlling seizures and epilepsy?
Sure. Well, I'll talk about the adherence part first. And, hearing your story, Mia, it is just, I definitely have heard that similar description many times from patients. And I think when I started started my center, started working with the diet, I worked with a dietitian and we were both learning about the diet ourselves. And so we learned so much from our patients. And I think we initially weren't educating about expectations up front. And so now what we do is we start by telling individuals who are going to be starting the diet, okay, in 6 months, 50% of people who start a diet as an adult quit. And it doesn't matter if it's a keto diet, another kind of diet, half of people just decide, no, thank you. And that's just human nature. And so first of all, that's okay. That's totally okay. And then we also do go over statistics. You mentioned that the diet can be very effective with patients with anti-seizure medicine resistant epilepsy. Now, unfortunately, that is just a very difficult as you've experienced personally, a type of epilepsy to treat. So the diet may not be effective for that. And so we do talk about it. We talk about reducing seizures versus getting rid of them completely. And of course, that's the hardest thing, because to drive, to be a young adult who's, out in the world, you really would like to not have any seizures. And I completely hear that and I get that. So we do talk about those expectations up front now. And I think that that's super important, just so that you have an idea. What we've heard from patients is that once they have that tool, that is something that they have some amount of control over. And I think, you can tell me if, that whole concept of not having control is part of what's very hard about the epilepsy. It just gives you a piece of it that you do have some control over, but you don't want it to control you. And I think that's the part about the diet we have to be really sensitive and think about. And so researchers are looking now at quality of life and trying to find measures of quality of life to make sure that even for people that the diet worked for their seizures, okay, how is it affecting their overall quality of life? Because if they're doing it and it's actually not benefiting them just in terms of their overall happiness, even if their seizures are better, well, then they shouldn't be on it. So I think your journey that you have been through is very, very familiar, and something that, us as the clinicians are really still trying to figure out how we can help as best we can, but also understanding that, some people it just doesn't work, and that's really okay too. Some of the things that we do that I think are helpful, that we've gotten feedback, from our patients that are helpful, we will do Zoom question and answer sessions where we invite patients to come join us. We have patients, since we started our center in 2010, we have patients that have actually been on a ketogenic diet or ketogenic diet therapy. There's so many different varieties since 2010, and can talk about their experience. So we give them opportunities to hear what folks are struggling with, and then say, oh yeah, I had that. Let me tell you what I did. Because as the physician, we train people on how to do the diet, but we aren't living it the way that you are. And so it's really nice to have those resources. And Sophie, you also asked the question about the mechanisms of action.
Yes, I know I kind of asked like a major question, but that was a great sort of intro into like the adherence aspect. And yes, thank you.
Yeah, absolutely.
But the mechanisms, correct?
Yes. Well, we only have, I think I understand, a short period of time to talk today. So what I'll say about the mechanisms of action, there are some very, very smart basic scientists that are trying to answer that question. And it seems like every person that looks into this question finds a different answer. So there are about 16 or so different categories of mechanisms of action. I think one of the really interesting things that's being looked at now, and it makes sense, the microbiome, so how the diet can affect changes in the gut microbiome and bacteria, and how that can then affect the brain and epilepsy. And so that's one area that's right now a kind of hot topic that's being looked into. We know that it changes neurotransmitters. We know that it changes inflammation in the body and in the brain. And so those are just some very general basic ways that the diet works. We know that ketosis itself, so the state of breaking down fat and having more ketones in your system, can be helpful, but we also know that's not the only thing, because for people that do have improvement in their seizures, it can be completely independent of what their ketone levels are in their body. So that doesn't seem to be the only thing. Carbohydrates have been shown to be pro-inflammatory, so actually that is part of the reason why we're talking about epilepsy today, but the diet is now being looked at for all kinds of other conditions, because if you try to get rid of some of those carbohydrates, you'll actually see other health benefits as well, completely even outside of epilepsy, because it can reduce inflammation.
With all this information, how does a patient know if they should start looking into a ketogenic diet, or if is there a certain kind of epilepsy that it works best towards? Is there some kind of signs that they should look for? And Mia, I'm kind of also curious if some of those signs you recognize yourself, you're like, oh yeah, that's something I pursued because of because of that?
There are two kind of categories of patients where I would recommend the diet. And of course, I'm biased as well because I have a diet center and I think the diet can be very helpful for some patients. If a patient has anti-seizure medicine resistant epilepsy, and if anyone doesn't know the definition of that, it's if you've tried 2 or more anti-seizure medicines that are appropriate for your kind of epilepsy and you've continued to have seizures. There's kind of a decision tree at that point. And Mia talked about some of these things. There's a vagus nerve stimulator or other implantable devices. There's epilepsy surgery. And some people are candidates, some people are not. And some people hear the word surgery and they say, no, thank you. And that's absolutely an appropriate response as well. And then there's diet therapy. So for me, it's that point in time when a patient, when you realize they have focal epilepsy coming from a part of the brain or multiple parts, and they can't get control with having tried 2 medicines, where I would consider the diet, if as a clinician, I would then bring up the diet as an option. So that is what I see. Now, there's another category of patients that have generalized epilepsy. So the seizures start from the whole brain at the same time and still instead of part of the brain. And usually those patients actually do respond to medicine very effectively. They often have a genetic disorder or some kind of a cause for their seizures. So once they're on the right medicine, they often respond, but there's a subcategory that don't. And we found in research that actually those patients respond the best to the diet. Again, we have no idea why. Well, we have many ideas of why, but we really don't know. And that in general has been kind of the finding. And then I guess I said 2 categories. There's 1/3 very, very specific type of epilepsy where the brain actually doesn't take in glucose the way that it should. It's a glucose transporter type 1 deficiency syndrome. And in that case, the diet feeds the brain because patients can't get the fuel that they need through carbohydrates. So you need another way to fuel their brain, and it's very effective in that condition.
I know you mentioned having similar things about like your seizures not being treatable through medication. So I'm curious to hear more.
Yeah. So I've essentially exhausted all the medications that are available to women with epilepsy. There's less available to women than there are to men. And I've basically tried them all and they aren't working. And so we started to kind of look down the surgery path. I'm not a fantastic candidate for surgery, and it's also just a very long, exhausting path to go towards brain surgery. So we thought before we go down that, also brain surgery is a huge commitment and a scary commitment. So we're like, before we go down that, why don't we try something low risk? And also VNS I'm not a great candidate for any of the implants either. I may try them now after keto didn't work, but we're like, why don't we try something that's just so low risk? The medications aren't working. And so we gave it a shot. It didn't work, but I did line up as a candidate that it could work for. And I would recommend it really to anyone because fumbling around with medications as someone who's drug resistant is incredibly frustrating. It's also difficult on your mental health. And the side effects can be terrible. A lot of, anti-seizure medications have some terrible side effects. So going on keto, it can be a little frustrating, but if you learn how to manage and they have some support groups and, you get the hang of it, it can be less frustrating or less tolling than, trying to fumble through medications. So I think it can really be a great option for people who are struggling to stop their seizures. And also seizures in themselves are very, very difficult to deal with and have their own side effects. Yeah. So it was.
How do you get into a groove, or how do you kind of like get a better at implementing keto into your day-to-day life? Because I know you mentioned it was actually really jarring at first to see all these restrictions and rules.
So basically what I did is I tried to find ways that I could bring back some normalcy from my old eating habits, my old diet, into my keto diet, because I went from having like autonomy over my eating habits and just freedom to as my dad always said, like I was a prisoner of my own diet. Like I just had all this free will to almost nothing. And so I tried to find ways where I could be normal again. So I found some great like keto companies that had like keto snacks, because I used to like to snack, or like when my family would watch movies, they'd have popcorn and I had to sit there and eat nothing. And like it would like moments like that, you would feel so like, oh my God, keto sucks. Everyone's sitting here eating popcorn. I'm sitting here not getting to snack or anything. Like you would just get so in your head. So I'm like, let's try to attack those moments. So I found a couple brands. It was like Catalina Crunch, 7 Sundays. They had all these great little snacks that I was like, okay, that can like feed my snacking urge. Or so when I'm feeling like everyone else is eating or getting to have a good time and I'm not, like when I go to parties and, there's snack bowls and chips, I'd sit there and couldn't have anything. So I would bring like my snacks with me. And so then I wouldn't be at the party, alone while everyone's having a good time or watching the football game and having snacks, and I'm sitting there doing nothing. So I tried to find ways to bring back my normal life. Another thing was having to cook all my meals was, I wasn't really used to that before. I used to not really do a lot for breakfast or lunch. So in order to help myself with that, I would cook a big dinner, like a two serving size dinner, and then have save half of that for lunch the next day. So I went from having to cook 3 meals to only 2 meals, because then I would have the leftover for lunch. So that helped. I found ways to just make everything a little bit easier and a little bit more normal. And there's also this website called the Charlie Foundation. I'm sure Dr. Cervenka knows of it. It has so many recipes and so many snacks and like dessert recipes, which their dessert recipes saved me, because holidays came around, birthdays came around, everyone's having dessert and like all this stuff. And it's like when you're sitting there and everyone's having dessert and you're not, it also sucks. Or like Halloween comes and you're just like, I'm not trick-or-treating anymore, but like everyone's like eating some candy and you're like, okay, like you can't even have one piece. Like keto, you can't cheat. There's no cheat days. Like other diets, people can have cheat days. You can't have a cheat day. So it's like you had to I found ways I'd make these desserts, and then it felt like I could have my dessert while everyone else had theirs, and like found ways to make yourself feel normal, because you felt so not normal anymore. And that's just what really helped me. And I don't know, that kind of helped me, like the mental part.
That is all great information. And I feel like, especially for dealing with some of the more like psychological side effects of transitioning to any big diet, I mean, that's all sounds like really great resources. I'm curious, as we talked a little bit about medication side effects and the psychological side effects of keto, are there any like physical side effects of the ketogenic diet therapies to be aware of?
There definitely are. And I think that's why thinking about therapies, just like you said, it's so important. And it also worried me when what I call the keto craze sort of came about several years ago, because I was hearing about people that were sort of doing this independently and just weren't aware that this is really a therapy. It can have risks. Some of the major ones, the one I heard about most often in people that had no idea, kidney stones, which I've never had one, fortunately, but what I understand is it's kind of the most painful experience that you could possibly imagine when you have to pass a kidney stone. Any type of ketogenic diet, because the ketone bodies are acidic, they can produce kidney stones. They can also cause bone loss in the long term because of the acidity of the diet, because of possibly if you're doing it without enough multivitamin, vitamin D, calcium, you can actually deprive your bones of those things and they can become more brittle. And so people aren't necessarily aware of that. Obviously, it became popular for weight loss, and the reason was because the state of ketosis actually blunts your appetite. So you can lose a lot of weight, but you can also lose too much weight. Or if you are a healthy, thin person who is on the diet for epilepsy, you may not need to lose weight, and that can be a side effect as well. There are some other conditions where if your ketones go too high, so if you're an overachiever on the diet and your ketones go very high, you can get something called the keto flu, where you feel nauseous, you feel like you're going to vomit. It feels, just from what I've heard and understood, it feels just like you have the flu, except just not.
Yeah, it was terrible.
And that's from having the ketones. So you've had that, Mia. I'm so sorry.
Yeah, it wasn't. Wow. I would drop in and out of keto a lot. Also, I had trouble staying within ketosis which was also frustrating because I felt like I was doing a great job of tracking everything. And so we couldn't really figure out why I was dropping in and out of it. But then it caused me to feel sick. I felt like I had the keto flu a lot, and I just felt sick all the time, which was also frustrating for myself because I'm like, I feel like I'm doing everything right. I'm tracking everything. I have a food scale. I'm weighing everything. And then it's like, why aren't I staying in it? So it was the mental part, but then also I'm just like sick. I'm like, aren't I supposed to be feeling better? Like, aren't I supposed to be having no brain fog and like sleeping better? Instead, I was just like sick all the time. So I feel like that also is something that isn't talked a lot about, the keto flu, because I feel like people just talk about how great they feel on keto. But you can't feel great. I don't want to scare people away. I'm worried I'm scaring people away, but it just manage expectations.
I mean, I think that there's like you said, it's about managing expectations and understanding. I think one of the really difficult things about epilepsy in general is that it's so individual. And so people are constantly looking and asking us about what they can try because there are so many experiences of people trying different medications and things that just like don't work like they worked for other people. And I think arming people with the information, good and bad, is important. And it's a frustrating part, I think, of having epilepsy, that it doesn't feel always like one solution is so perfect and clear and easy. For most people, it seems like it's not that way, but it is an unfortunate reality. And it's good that, we're talking about it.
And I think a lot of our listeners want to have like a big view of what's happening in the landscape, rather than kind of just like a reduced, truncated, like, no, keto works for everyone, and just like Sophie said, epilepsy is so individual, and it's important to treat the process just like that. And I'm kind of curious, like, how long does someone have to be on the diet? Like, can it ever be stopped? And Mia, it sounded like you were kind of weighing out the pros and cons with your family, and you're like, currently the cons are outweighing this, and that encouraged you to stop it. But Dr. Cervenka, at what point do you encourage a client to maybe go on, stay, or what's that process like?
Well, in children, they actually pediatric neurologists will typically stop the diet after 2 years. And that is sort of a standard practice. It's a little bit arbitrary, 2 years, but that tends to be how it's managed. One of the things that I didn't mention in terms of side effects, so in children, it can stunt their growth because they're not getting enough protein. And so because of that, a lot of times they'll only do it for a short period of time. So adults obviously have already reached their growth and their height. And in that case, they could theoretically be on the diet longer. Now, with someone like Mia, who has anti-seizure medicine resistant epilepsy, they may need to be on a diet a little bit longer than 2 years to be able to see benefit and things like that. And so that's how we have some patients who have been on it now for as long as we've had our center, is because they've found the benefits of it and they haven't had those side effects that we've talked about. But certainly I see them every year. We keep looking out for side effects. There are ways of doing bone mineral density scans to make sure that there aren't problems with bone health. We have them exercise and take supplements to make sure that all of those things are going to be okay. And then for some of those rare conditions where the diet is really the first line, those patients will stay on the diet for their entire lives. So I do have patients that I've inherited from my pediatric colleagues who have been on the diet for 40 years, believe it or not, the classic ketogenic diet. So just to kind of give an idea of how long it can be, and perfectly healthy individuals.
What is kind of the success rate for the diet in general? Do you have those statistics?
It varies depending on the type of epilepsy. When we talk about anti-seizure medicine or drug-resistant epilepsy, the statistics are about 40% chance of having a 50% or greater seizure reduction. And so that's usually the metric for what a responder is. The problem with that is what we talked about earlier, that doesn't allow you to drive because it's only a 50% reduction. It's not getting rid of the seizures completely.
Yeah.
Depending on the center, depending on the experience, it can be up to 20% of seizure-free rate. And so that, 20% is 1 in 5, but for people that have been through all of the medicines that are not candidates for surgery or not ready for it, they want to give that a shot to see if they can become seizure-free. I think over longer periods of time, you can also see additional seizure reduction. So even if in your first month, your second month, your third month, you see, okay, I'm having 4 seizures a month instead of 5 seizures a month, but next month I have 3 and next month I have 2, and we find different ways of fine-tuning the diet, we call it. Sometimes we can keep seeing more improvement over time.
That makes sense. Can you, if you're somebody who medication is working for, can you remain on medication as prescribed and still explore, like if medication helps reduce your seizures and then you pair it with keto, can you remain on your medications typically?
Yes, so that is actually the most common approach, is that it is used as an adjunctive therapy, so in addition to the medications. We do have patients that come because they have not had the best success with their medicines, they're having side effects, and they would like to be on less medicine, and we do use the diet in that context to keep them seizure-free and try to lower the medicine too. So that is a different strategy than what we've talked about so far. But in general, if you were already having seizures and you start the diet, you would stay on the medicine that you were on at that point.
Okay, that makes sense. I could see it like with people do really have a lot of issues with side effects of a medication and potentially being a tool to help manage that. Karan, do you have any other like last minute questions for them?
No, I actually was just thinking about how I've like such a clear image of what the ketogenic diet looks like, both in terms of like risks and benefits. And I'm actually curious, as a final question for both of you, what are some misconceptions you both come across in terms of keto, whether it be in your day-to-day or just kind of in the general zeitgeist?
For me, I think the biggest thing, especially with, I don't know if it's my generation or my age. I'm 25, by the way. So a lot of people know what keto is and really only know it in the context of losing weight and a diet to lose weight. A lot of people would be like, oh, my mom did keto. Oh, like you're trying to lose weight, or my mom did it. It wasn't that bad. Or they'd even be like, oh, I tried keto. I lost 10 pounds in 4 months or whatever. I'd be like, and especially what I learned when I went through keto is keto that people did to lose weight is not the same as the keto I was doing. So when I went to grocery stores, if something said, oh, keto cereal, I actually had to read the label, and it probably wasn't keto. It wasn't going to be the keto I needed because it included sugar, alcohols. You would learn this with your dietitian if you go through the keto process. But basically, the diet keto is not really going to be the same as yours. It's not as restrictive, or I don't want to say it's difficult because I'm sure it's still difficult. Any diet is. But it almost felt like it was minimizing what I was going through, or it felt like people were like, oh, I'm just trying to lose weight. In reality, they were trying to make me gain weight, which was a whole nother mental thing, especially as a girl. And so it just felt like, I feel like a lot of people with epilepsy experience this in so many aspects of their epilepsy journey, where it feels like your experience is being minimized or chalked up to something else that someone else is going through. It's like, okay, well, you chose to go through keto to lose weight. That's not why I'm doing it. It's a whole different story. It's just it was just whole like give and take of these conversations. I was like, I can't be a part of this right now. I'm going through something. It's really hard for me to talk about your mom who did keto to lose 10 pounds so she could fit in size 4. Like I can't, it was a lot of like that. And it's just, I had to prepare myself for those conversations and handle them with grace instead of frustration. And that's just kind of, you're going to have so many of those conversations with people, and you have to be prepared for that.
Yeah.
And it was a good opportunity to educate also.
And that's great, because I think that is like the biggest thing is what Karan and I said we didn't know either. And like what you just said about the keto products in stores, and like I know they count like fiber and sugar alcohols as like they don't count effectively. And I mean, right there, I think my biggest takeaway from this conversation has been like work with a clinician, because there's so much, especially when something becomes a diet fad online, there's going to be so much misinformation about it. And then also, I think talking a little bit about the psychological impacts, especially as a young woman, I can only imagine. So thank you for sharing that. Dr. Cervenka, what is your biggest misconception that you wish people knew?
You all have hit on it completely. It is the whole concept of keto for weight loss. Just like you said, Mia, this description of walking into the grocery store and seeing this big keto sign on top of even the wall itself, of a wall of keto products. And I think for the public to understand that, the Food and Drug Administration doesn't have labeling that they follow for something to be called keto. So anything can put the word keto on the front of their box. And Mia just described it. You have to flip it over and look at the back of the box to see if the thing has anything to do with keto whatsoever. And then the whole concept that it is a healthy diet is just actually not the case. It isn't a healthy diet. It can be healthy, but you have to take all those measures that we've talked about to make it a healthy diet. So, what you just said about having a clinician, and in particular, a dietitian, a nutritionist, someone who can really follow along that whole process is just absolutely essential.
Thank you so much to Mia and Dr. Cervenka for joining us today. For anyone listening who wants more information, you can find us at thecameronboycefoundation.org or our social medias. We encourage you all to check out our support groups and get involved. As well as if you're interested in the ketogenic diet, please talk to your neurologist, explore all your options with your doctors. Thank you for joining us, and thank you to our sponsors at UCB for making this conversation possible.